The first 6 weeks is critical. In order for an anatomical shoulder replacement to be functional and last, the cuff has to be intact. And in order to do the procedure, you have to take the rotator cuff off the front of the shoulder, and then you put it back at the end to repair it. And if you don't immobilize it and protect that before it heals, the shoulder won't last, and it'll ultimately fail, and probably fail quick, within the first 5 years. So that first 6 weeks is critical. Wearing the sling, protecting that repair. And then after that 6 weeks, then we start motion. During the first 6 weeks, though, I do have you see a therapist, and they help you move it without stressing that repair. But then once we get through the 6 weeks, we can start progressing. Most patients afterwards, I would say 90% of folks come back at their 2-week post-op and have less pain than they had before surgery. And very, very few use pain pills for very long at all, maybe a few days. So pain relief is fairly instantaneous, but the function does take time. And just like rotator cuff repairs, and just like most other orthopedic procedures, it takes a year to recover fully. It really does. To get full function, full strength, it takes a year. You think, with your limited mobility with shoulder arthritis, the rotator cuff really isn't getting used very much, and it takes a long time to build up that strength. But again, most people even by 6 weeks are super happy. By 3 months, definitely happy, but it just takes time to get that full recovery.